If you've recently had blood tests and been told your inflammatory markers are high, you're probably wondering what that actually means. Many patients see terms like ESR or CRP on their blood test results and immediately become worried. Does it mean infection? Does it mean autoimmune disease? Could it be something serious? In this video, I'm going to explain what inflammatory markers are, why they can become raised, what ESR and CRP actually mean, and when high inflammatory markers should be investigated further. I'm Dr. Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology London. Let's start with the basics. What are inflammatory markers? Inflammatory markers are blood tests that help detect inflammation somewhere in the body. The two most commonly used markers are CRP, which stands for C-reactive protein, ESR, which stands for erythrocyte sedimentation rate. These tests do not tell us exactly what condition someone has. Instead, they tell us whether inflammation may be present. They are useful clues rather than definitive answers. Now let's talk about CRP first. CRP is a protein produced by the liver in response to inflammation. When inflammation increases in the body, CRP levels can rise quite quickly. This makes CRP a very useful marker for detecting active inflammation. CRP can rise due to infections, autoimmune disease, inflammatory arthritis, injury, surgery, and many other conditions. One important thing about CRP is that it often changes relatively quickly. If inflammation improves, CRP levels may also fall fairly quickly. Now let's talk about ESR. ESR is a slightly different test. It measures how quickly red blood cells settle in a tube over a specific period of time. When inflammation is present, proteins in the blood change and cause the cells to settle faster. A high ESR may therefore suggest inflammation. However, ESR is generally slower to rise and slower to fall compared with CRP. It can also be influenced by other factors such as age, anemia, and pregnancy. So ESR can sometimes be less specific. Now, one common question patients ask is, what's the difference between ESR and CRP? CRP tends to reflect more immediate or acute inflammation. ESR is often more gradual and can remain elevated for longer. In clinical practice, we often interpret both together alongside symptoms and examination findings. Now, an extremely important point is this: high inflammatory markers do not automatically mean autoimmune disease. There are many possible causes. Infection is one of the most common reasons for elevated CRP or ESR. For example, chest infections, urine infections, dental infections, and skin infections can all raise inflammatory markers. Even relatively minor infections may sometimes increase CRP. Now, inflammatory markers can also rise after injury or surgery. The body naturally produces inflammation as part of healing. So elevated CRP after an operation is often expected initially. Now, in rheumatology, inflammatory markers are particularly important because autoimmune and inflammatory disease commonly raises them. Conditions such as rheumatoid arthritis, lupus, vasculitis, polymyalgia rheumatica, psoriatic arthritis, and ankylosing spondylitis can all lead to elevated inflammatory markers. However, this is where things become slightly more complicated. Because inflammatory markers can sometimes be normal even when autoimmune disease is present. This surprises many patients. Some people assume my CRP is normal, so I can't have inflammatory arthritis, but that is not always true. Certain patients with inflammatory conditions may still have normal blood tests, particularly early on. This is why diagnosis is based on the overall clinical picture rather than blood tests alone. Now, another common question is, how high is too high? The answer depends on the context. Mild elevations can occur for many reasons and are not always concerning. Very high CRP levels may suggest significant inflammation or infection, but interpretation always depends on symptoms, examination, medical history, and other test results. For example, a mildly elevated CRP in someone with a recent viral illness may not be worrying, whereas persistently elevated inflammatory markers together with swollen joints and fatigue may require further investigation. Now let's talk about symptoms that may suggest inflammatory or autoimmune disease. You should pay particular attention if raised inflammatory markers occur alongside prolonged morning stiffness, swollen joints, fatigue, and unexplained weight loss, as well as fevers, rashes, muscle pain, back stiffness, psoriasis, and Raynaud's phenomenon. These features may point towards an inflammatory condition. Now, another important question is, can lifestyle factors affect inflammatory markers? The answer is yes. Obesity can sometimes mildly increase CRP levels. Smoking may also contribute. Poorly controlled chronic medical conditions may influence inflammation as well. So not every raised inflammatory marker reflects autoimmune disease. Now, one important thing I always emphasize is that blood tests are only one part of the assessment. In medicine, we treat patients, not just numbers. Two people can have the same CRP level, but very different underlying causes. That's why proper clinical assessment matters. Now, another common question patients ask is, what happens if inflammatory markers stay high for a long time? Persistent inflammation should generally be investigated, particularly if symptoms are present. This does not necessarily mean something dangerous is happening, but ongoing unexplained inflammation usually deserves further assessment. Additional blood tests, imaging, or specialist review may sometimes be needed. Now let's discuss autoimmune disease in slightly more detail. In rheumatoid arthritis, inflammatory markers may rise because the immune system is attacking the lining of the joints. This causes inflammation, pain, stiffness, and swelling. In conditions such as vasculitis, inflammation affects blood vessels. In lupus, inflammation can affect multiple organs. So inflammatory markers can provide useful clues about disease activity. Now, another important topic is monitoring treatment. Inflammatory markers are often used to monitor how well treatment is working. For example, if someone starts treatment for inflammatory arthritis and their CRP falls alongside improvement in symptoms, that can suggest inflammation is becoming better controlled. However, symptoms always remain important. Some patients feel significantly better before blood tests are fully normalized. Others may still feel unwell despite improvement in inflammatory markers. Now, another thing patients often ask is, should I worry if my CRP is only slightly elevated? Not necessarily. Mild elevations are common and can occur for many reasons. The key is understanding the context and whether symptoms are present. This is why it's important not to interpret blood tests in isolation. Now let's summarize the key messages. CRP and ESR are blood tests that help detect inflammation. CRP often rises and falls more quickly. ESR tends to change more gradually. Raised inflammatory markers can occur due to infection, autoimmune disease, injury, surgery, chronic medical conditions, and many other causes. High inflammatory markers do not automatically mean autoimmune disease. And importantly, autoimmune disease can sometimes still be present even when inflammatory markers are normal. Blood tests must always be interpreted alongside symptoms, examination findings, and the overall clinical picture. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms or blood test results and would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.